Laughter. Those of you that don't know me, I'm the 2021 Health Council President. So welcome everybody. Thanks for joining us today. It's a little bit gloomy outside I'd say my office, my home office today. I'm still at home, like most of us. We've been meeting as a Health Council virtually now for over a year. So probably about March of last year, we started meeting virtually. And I'm happy to announce that we have started talking about getting back to in-person meetings. So we're hoping maybe by July to be back at Deerwood, which is where we normally meet on the first Thursday of every month. And I know I've had a lot of people ask me about, hey, when are you going to get back to in-person meetings? And so we've maybe waited a little bit longer than others, but we wanted to be, like we've talked about, respectful of all of our healthcare professionals and everyone in the community, making sure that we were ready and all of our members of the council were ready to get back to in-person meetings. So we're excited about that. So keep watch for the next couple months to make sure once we do get back to in-person that everybody's aware of that. And we'll be happy to actually see each other and not just virtually see each other. A little bit about the Health Council. We are one of, remind me, Kathy, 7 or 8 councils one of 8 councils that are part of the JAX chamber. And like the name implies, we really focus on different health and wellness topics that impact the Jacksonville and surrounding areas. It's been really interesting this year. We've had a lot of speakers similar to what you'll hear about today that are, talk about topics that maybe you don't initially think of are health related. But as we've learned, like last month, we had someone talk to us from Ability Housing and about the role of affordable housing and what that plays on health outcomes. And so we've learned a lot, and I think we're going to continue to learn a lot today when we hear Dr. Sack talk about environmental sustainability. So if you will advance the slides, please. This is our agenda. I've got a couple of announcements that we'll go over. Kathy's got a couple of announcements relative to various events going on with the chamber. We'll get into Dr. Sack's presentation. And then depending on how long that runs and how many questions we have, we obviously want it to be an interactive discussion. Then we may have some time at the end for virtual networking. If not, that's fine too. And then we'll come back together to just go over some reminders about what's coming up over the next couple months. Next slide. So I would obviously be remiss if I didn't mention our board of directors. As I mentioned, I'm Jason Lafser, I'm the president, but all of these people that you see on the screen are the ones that work with me to make sure that, things get done. So it's a big job to make sure, we bring great content like we are today. And then we have, we've got people like Jen that does a great job of promoting us on social media. And, people like Ashley, who is not with us today, but she's responsible for making sure that we get great presenters each month. And so it really is a joint effort by all of us involved. And I want to thank each and every one of them. And then mention to everybody that's on the call today, if you are interested in getting more involved with the Health Council, please reach out to any of these individuals. Myself or any of the other board members would be happy to have a conversation with you about how you can get more involved or what roles there may be. Besides the board of directors, we have various committees as well. So it doesn't have to be hey, I want to join the board. It can be something as easy as, hey, tell me what to do and I'm happy to get involved. So please reach out to any of these individuals. And then also, as always, I'd like to thank our sponsors, Florida Blue and Moran Builders. Both of those sponsors contribute not only money and funds to our council, but also time of their individuals and employees. They each have board members that sit on our board, so we're very thankful to them. They allow us to do the things that we do, not only putting on events like we did with the cooking class that I mentioned last month, or I guess it was last week, but I mentioned it last month. But also being able to allow us to give back to the community as well. So thanks to Florida Blue and Moran Builders. And with that, I think it says Tina Robbins, but I told Kathy somebody let her take a vacation. So Tina's not with us, but Kathy's going to talk about some things going on with the chamber.
Hey, you guys, just a couple of things I want to mention. PWC Council is having one of their signature events this month. It's Networking with a Bang, and that's going to be next Thursday, May the 13th. It will be at the Bonefish Grill in on San Jose Boulevard. So starting at 5 o'clock, it's $20 if you'd like to go, and that's in advance, and $25 at the door. So please support your council members and go participate in this event if you have the time and would like to go. And the other thing I just want to bring up, if any of you are new members with the Jacksonville Chamber, our Chamber 101 is coming up. We do it every other month. So it's May the 26th. That's a Wednesday at 11:30, and lunch is provided. You do have to register for that. So if that's something you're interested in, I highly recommend that you attend. You will learn a lot about how to get plugged in with the chamber. And that's everything I have.
Okay. Well, with that, I will introduce Dr. Sack. And like I said, this is going to be a very interesting presentation. I talked to Dr. Sack a little bit, and obviously we are the Health Council, but he assured me that what he's going to talk about, we can all apply to our businesses. So whether you're a healthcare business or not, even individuals, I think there's going to be a lot that we learn. So Dr. Sack, a little bit about him. I've known Todd for probably over 15 years. So I'm happy to get to hear him speak. He speaks nationally and internationally on today's topic of sustainability, health, and business. He's a leader in the Duval County Medical Society, the Florida Medical Association, the American Medical Association, and the World Medical Association. So I think you've got them all covered there, Todd. He chaired the Jacksonville Environmental Protection Board and the board of We Care Jacksonville. And he served on JEA's Clean Power Advisory Group and was twice appointed by Senator Marco Rubio to the Florida Energy Commission. Todd serves on the boards of MOCA Jacksonville, the Timucuan Parks Foundation, and Physicians for Social Responsibility in Florida and Washington, D.C., who he's speaking for today. He was an assistant professor of medicine at the University of California School of Medicine in San Francisco, and has practiced gastroenterology here for 35 years, now as a medical director for We Care at Borland-Groover Clinic, caring for the uninsured. He's a graduate of Yale College and is married to Dr. Barbara Sharp, and they have 3 sons. So with that, Todd, you're on. You're on mute, Todd.
All righty. Thank you very much. Good afternoon, everyone. Thank you, President Jason, for the wonderful introduction, and to Ashley Suzakowski for organizing this, and Kathy Sutton for the logistics. Thank you, Kathy. You're so well organized. I'm very impressed. Let me go ahead and screen share and go and start my talk. Here we go. Good. So my talk is entitled Adding Environmental Sustainability to Your Business and to Your Life. And environmental sustainability is huge in the news these days. And I'm going to bring you up to date with some really exciting work that occurred at the City Council last year. You may not know, but there was a huge resiliency process that occurred with more than 3 dozen committee meetings, about 60 volunteers from community, 5 city council people that came up with really exciting recommendations for resiliency planning for the city. I'm going to talk about those because I think you'll see these topics popping up in the business world over the next year or two in a very prominent way, and how you position your own business and those you consult with can be very important. And I'm going to talk about environmental sustainability for your business itself and in your own lives, the lives of yourself and your family. I think you'll get a lot of ideas. Write down questions. I love questions, and we'll have time to talk afterwards. A bit about myself. I think we've already heard about me, so I'm going to keep going. I'll talk just a moment about Physicians for Social Responsibility, which is a charitable nonprofit, been around for many, many years. PSR shared the Nobel Peace Prize twice, which is pretty impressive. We have health professional members in 20 state chapters, and we deal with the existential threats to mankind, nuclear war, and climate change. Take a look at psr.org. Lots of great resources for yourselves and for your families. I'm going to talk today very briefly about climate science, just so we're all on the same page. Because I'm a doctor, I'm going to talk about the health threats, particularly threats that we will face in Jacksonville over the next 20 or 30 years and that we need to prepare for. I'm going to talk about Florida's resiliency planning record, a lot going on. Then I'm going to turn to business opportunities for Northeast Florida and focus upon two in particular that I think will be relevant to this group. I'm going to talk about adding sustainability to your business. I'm going to talk briefly about a service that I run called My Green Doctor, which is used in healthcare offices. So if you have an healthcare office or you assist healthcare offices, I think you'll find this helpful. And then we'll talk about things you can do in your own life at the very end. So this is five slides on climate science. This is a graph showing the average Earth temperatures 1880 to now, recorded by 4 different research centers on 3 different continents. And no matter who's doing the recording, the results are the same, that the global temperature has gone up about 8.85 degrees centigrade, or about 2 degrees Fahrenheit, since the beginning of the industrial era. But I'm going to show you something surprising about that, which is that if you look at our own region, this is the same time period, 1800s to present, but for the Southeast, for Florida, Georgia, and Alabama, looking at the average Earth temperature. And if you look at this, I don't see any warming occurring. And indeed, that's the case. The Southeast has not had a warming of average temperatures over the past 120 years. And this is what climate scientists tell us will happen, that there'll be some regions very heavily affected by climate change and others less affected. I'm going to show you one more slide about this. This slide looks at the same average temperatures over the past 100 years for more than 100 US cities. And what you can see in red are the cities that have warmed a little bit, and in blue are those that have cooled or haven't changed their average temperature. And what you see is in the Southeast, we haven't really experienced the average temperature rise that the rest of the country has. And in many ways, I think this explains the politics of climate science in the United States. There are places in the country where people feel it. It's intrinsically obvious that something has changed. And in those cities and those communities, voters are more likely to ask their leaders to step up to the plate and make some real policy changes to get us prepared. We in the Southeast haven't experienced it, at least from a temperature standpoint, as much as other areas. And so our politicians are less likely to get engaged. What's this all about? It's about the greenhouse effect. You've seen this before, that the sun comes in from outer space and heats up the planet. Much of the heat bounces off the Earth and goes back into space, but a lot of it is trapped in this layer of atmosphere, trapped by particular gases that are called greenhouse gases because they actually have the physical property of trapping heat. So it's been known for 200 years now that carbon dioxide is a molecule that traps heat, and there's some other gases as well. If we have too much of those molecules, the planet gets too warm. If we have too few of them, we get too cold. And people talk about the Goldilocks effect, that what we've been experiencing for the past 3,000 or 4,000 years in the United States is just right for human civilization. This is looking at greenhouse gas levels around the planet going back 1,000 years. And I'm not going to now discuss the methodology for learning that, but I can in the question and answers if people have questions. On the left is carbon dioxide, methane, and nitrous oxide. Methane and nitrous oxide being 2 industrial gases. Methane is natural gas coming out of the ground, and nitrous oxide is created by the burning of fossil fuels. And you all know carbon dioxide. And what you can see is that the levels of these greenhouse gases were relatively stable for the past 1,000 years. until suddenly in the last 50, 60 years, there's been a dramatic upswing in them. On the right are these industrial gases, the hydrofluorocarbons that are used in refrigeration. Their levels monitored since the late 1970s, and they've also gone up significantly in over the last 20 years. The significance of the hydrofluorocarbons is that these gases are more than 1,000 times more warming molecule per molecule compared to carbon dioxide. And so although these are present in far lower levels, their impact can be far greater. And the world has treaties in effect to get rid of these gases over the next 20 years. Now we're going to go back even further. This is data going back 300,000 years that's collected by looking at ice cores in Antarctica. There are 3 locations where scientists have dug deep into the ice to collect snow that was deposited hundreds of thousands of years ago. And they can actually measure carbon dioxide bubbles in those ice cores to see how much carbon dioxide was in the atmosphere when that snow fell. It's quite remarkable. And there are other ways of looking at temperature. But if you look at the pattern of temperature in red and carbon dioxide in blue over the past 300,000 years, you see a couple of things. One, the temperature and carbon dioxide just run together, hand in glove, over these many millennia. The other thing you notice is that the carbon dioxide has been in a pretty stable pattern of between 180 and 300 parts per million over the past 300,000 years, until the last 20 or 30 years when it's taken off. And the level of carbon dioxide in the atmosphere now at 420 parts per million has not been seen on this planet for many millions of years. People think as far back as 18 million years ago. And that's what's worrisome, that something has clearly changed. You know, if you look at this particular slide, human beings show up about 200,000 years ago. So during the whole existence of mankind, we've never seen carbon dioxide levels like this. You may ask, well, what's happened to temperature? Why hasn't temperature gone up if carbon dioxide has gone up? And the answer is that climate scientists tell us that there's a 40 to 50 year lag between CO2 going up and temperature going up. So, and there's some uncertainty about that too, because we've never seen such a quick rise in CO2 during human existence. So that's the big question. How quickly will temperature follow? And what will be the consequence of that? But let's look at what the world was like the last time it saw 420 parts per million of atmospheric carbon dioxide. This is in the middle Miocene era, 15 to 17 million years ago. To just put that in perspective, the dinosaurs left around 65 million years ago, and mankind showed up about 200,000 years ago. Carbon dioxide in the middle Miocene was between 300 and 500 parts per million, pretty big range. We're now at about 420. Temperatures were 3 to 5 degrees Celsius hotter than now. That's about 15 degrees Fahrenheit. Sea levels are 120 to 190 feet higher. That's quite dramatic. And as I said, we expect about a 40-year delay between CO2 levels and seeing some of these climate change effects. So that's the big question mark. How high will carbon dioxide go? And when will the changes occur if carbon dioxide is allowed to go higher? And it tells you why there's such a push to lower CO2 levels, not to allow them to go higher. So what was life like in Florida in the middle Miocene 18 million years ago? Well, this is a diagram from University of Florida showing what the landmass was like when it was so much warmer and the sea levels were so much higher. And what you see is there's very little left of Florida. That brown was the amount of earth that was above sea level. Everything else is gone. And the fear we have is that we have baked into the future already with the current level of CO2 at 420. We've already baked into the future that all the glaciers will melt and we'll end up with these sorts of sea level rises. So that's the scary picture that we don't want to see 100 to 150 years from now. Let me go back a couple, sorry. So just to summarize, pretty much everyone agrees that global temperatures have risen over the past 100 years. that man-made greenhouse gases are the only plausible cause for warmer temperatures. I don't have time today to talk about the other factors that have been pretty much excluded, the Earth's wobble, sunspots, things like that, but I can go over that if anyone would like to. But more importantly, that for Florida, rising ocean temperatures will create hotter days, greater storms, flooding, and hardship in the years ahead. So I've talked about the science. Now let's talk about the health threats, and I'm going to be quick on this. On the left are the climate changes. On the right are the health impacts that we are planning need to keep in mind as we're planning our future. Rising temperatures, rising sea levels, and extreme weather events, which means extreme heat days, days where it's 115 to 120 degrees Fahrenheit, extreme rainstorms, which can cause flash floods, hurricanes or tornadoes, other types of flooding events, droughts and fires. And on the right are heat-related deaths, that I'm going to talk about more in a few minutes, asthma and heart attacks. It turns out when the temperature is warmer, the air pollution is chemically changed to more toxic materials, increasing the rate of heart attacks and asthma, cancers from the pollutants in fossil fuels, emotional illness from the stress of all this, emerging infectious diseases, malnutrition and famine, which we're already seeing in some parts of the world, and then the issue of war and climate refugees, which we're also seeing at present. I want to talk particularly about heat events. This is an example of an extreme heat event in Europe that occurred in 2003, where for 1 week they had spectacular warm temperatures, particularly in France, southern England, and in Germany. And they found an estimated 70,000 excess deaths occurred just in that 1 week. At risk, the elderly, the chronically ill, young children, and interestingly for Florida tourists, because tourists come to places like Florida, not expecting and not acclimated to the extreme heat that can occur. And particularly at risk of those without access to air conditioning. So what do we do? How do we plan when the power goes out on an extremely hot day in Northeast Florida? So how do they know that there are excess deaths? This is a slide that shows the number of deaths that occurred, the number of bodies brought into the morgues for a few villages in France during this particularly hot week. And what it shows is that there was if you look at the number of deaths that occur on these weeks during the year, then in this particular week in August of 2003, there was huge spikes in the number of deaths reported. And overall of Europe, it added up to about 70,000 excess unexpected deaths. And there have been similar episodes recorded in the United States, of course, not to this extreme number of deaths as this, on many, many occasions, episodes of deaths recorded in Chicago, Baltimore, New York, and other cities. So America is not immune to this problem. This is 2017, the picture of the hurricane barreling up towards Jacksonville, and the impact of flooding in downtown Jacksonville was pretty catastrophic. This is a few blocks from the river, so it's not just those along the river who are at risk. And more scary is what happens to just regular people in their homes. This is a Jacksonville neighborhood, horribly impaired by flooding from what was just a level 1 hurricane. So this was just a warning shot to Jacksonville. And it was this event really that spurred the city council to roll up its sleeves and have its resiliency planning committee and meetings last year. So let's talk about our resiliency planning record for Florida. Before I get to that, why do we care about this? Floridians are really worried about global warming. This is a poll done by George Mason University and Yale in the fall of 2019 that showed that in Duval County, 59% of adults are worried about global warming. St. Johns County, similar numbers, 52%. So the public cares about this. And in these polls, by wide margins, the public wants elected officials to do something. Here's an interesting figure that, from a business standpoint, the same adults are asked, is environmental protection more important than economic growth? and 69%, that surprised me. 2/3 of people in Duval County find environmental protection more important than growth, and in St. Johns County, also 66%. So the public cares about this, and they really want something done, and I think it's really, really interesting. What has been our planning record? In 2008, the Florida legislature passed the Florida Energy and Climate Change Protection Act. It was signed by the governor. It would have made put Florida well on track to be ahead of the game to prepare for our energy needs and resilience efforts. Unfortunately, it was shelved a few months later by the next governor and legislature. Florida DEP, though, Department of Environmental Protection, has been working on this, as had the Department of Transportation and other departments. DEP has its Florida Adaptation Planning Guidebook, which was released in 2018. Many municipalities are using this as the guide for them to begin resiliency planning. Several regional multi-county planning episodes are underway. Miami in 2010, Tampa began in 2018. And local St. Augustine has been working on this since about 2018, where they have terrific high tide flooding problems. This is coming to Northeast Florida. This is the picture of our beaches mayors together with Lenny Curry about a year ago, announcing plans for a multi-county resiliency planning process. I think it's remarkable that the mayor got all these people together, and also remarkable that the Times Union managed to make them all look terrible in this particular picture. So what has Jacksonville done for resiliency? We've had 4 committees studying only flooding. We have the Duval Prepares process, which is part of our local mitigation strategy. They've had reports out every couple of years since 2015. We had the Adaptation Action Area Working Group meet in City Hall in 2019 and 2020. The Storm Resiliency and Infrastructure Development Review Committee also meeting in 2019, 2020. The Public-Private Regional Resiliency Committee, working out of the Northeast Florida Regional Council, and working closely with the Chamber, all working on the issue of flooding, but not dealing with the broader issues of storm and heats, and more importantly, rolling up our sleeves and doing something about our air pollution and greenhouse gases. In 2020, the Jacksonville City Council convened its special committee on resiliency. There were 3 subcommittees, dozens of public meetings, 5 council members, scores of volunteers, which were called subject matter experts. I participated in that. My thanks to Councilman Carlucci, Councilwoman DeFore, Morgan, Dennis, and Boylan for their strong efforts sticking with this process. And out of it has come a number of changes. There's a new department created, the Resiliency Division under the Planning and Development Department. And the Resiliency Division is going to be looking at every decision of the planning in the planning arena to be sure that resiliency is considered. There's a new position of County Resilience Officer, the CRO, that's been funded, though has not yet been appointed. I think there's a job description out, so if anyone interested in that, take a look. It's going to be a very exciting job. And the chief and this will be chief liaison for all city operations related to resiliency and to coordinate Jacksonville's long-term resiliency strategy. So the city council has really put Jacksonville on the map as moving forward on this, and you're going to hear lots about this. Some specific recommendations also that came out of the special committee to broaden the resiliency definition beyond just flooding to add other health impacts of climate, social equity, and environmental justice topics. It's calling for meaningful citizen engagement, including a permanent community commission, maybe called the Resiliency Council. It's not clear yet, but I think you're going to hear calls for some sort of council or commission or board to be created, similar to what we do for other city issues like transportation and housing. We're probably going to have a resiliency board. There's a proposal to increase and maintain the city's tree canopy, to increase it by 40% by 2040, to develop a heat emergency preparedness plan, a recommendation to strengthen and enforce sustainability building ordinances, to create a greenhouse gas inventory for the city, to obtain LEED for city certification, and to adopt one sea level rise prediction to guide builders. Currently, the city and state haven't agreed on what do we need to plan for. And what architects and designers need is a specific target that they can work with so that they can be effective. So these are the bottom, well, this slide particularly, are all issues you're going to see come up in City Council this year and next year, and look to see how that affects your lives and your businesses. Okay, business opportunities. This is what you're here for. Skip too fast. Okay, I want to talk about solar power for your roofs and electric cars. This is a picture of JEA's Old Plank Road Solar Farm. JEA has 5 solar farms. There's big business and big money here. This is occurring because renewable energy costs have fallen dramatically. This slide shows the unsubsidized cost per megawatt hour to produce energy, and you can see that utility scale solar, which are those big solar farms like the one for Plank Road that I showed you, that the cost of utility scale solar has dropped dramatically. So it's now far cheaper than nuclear power, coal, or natural gas. Wind power is also cheaper than gas, coal, or nuclear, but we don't have good wind resources here in Florida, so you're not going to see wind play any significant role in renewable energy generation in Florida. Interestingly, look at nuclear. Jacksonville is building a nuclear power plant in Georgia. We're going to own about a quarter of 2 large nuclear reactors in southern Georgia. They're expected to come online next year. Unfortunately, the power that we're going to be purchasing from that nuclear plant will be very expensive compared to what we're now paying for natural gas and what we will pay for solar. But it's this table showing how the costs have decreased dramatically that are driving the move to renewable power. It's all about economics. So looking at solar power in Florida, it's skip forward. It's 2.1 gigawatts, number 3 in the United States by state, but solar is only 1.1% of Florida's electricity generating capacity, only serving about 250,000 homes. But it's jobs, currently about 8,500 jobs in the solar industry, growing to about 12,000 by the end of 2021. And these are good jobs in design, manufacturing, sales, banking, installation, and maintenance. 73 manufacturing companies making solar products in Florida, including in Jacksonville, a few. 299 installer companies and 208 other companies in the solar business. I read this week of a new bank in Tampa focusing solely on the energy market, the renewable energy market. So this is real business and real opportunity for you or for one of your companies or maybe for your children. This is going to be a solid career option for lots and lots of Floridians. How about JEA? JEA has a rooftop now on about 1,100 homes and 52 businesses. JEA has 5 solar farms and is expected to build more over the next 2 years. We have a little bit of wind that we purchased from Nebraska. We have a little bit of landfill natural gas that we create. So we're actually creating natural gas, harvesting it from our landfill, from our dumps. As I said, the nuclear power plant in Vogel, Georgia is expected to go online sometime next year. Currently, JEA's total generating capacity is about 2.1 gigawatts. Our renewable energy capacity is very, very small at 0.064 gigawatts. So we're far behind many places in the world with just 3% renewable energy generation for electricity. Second opportunity I want to talk about is the electric car. This is an electric charging station at a Walgreens in California. You know, this charging station isn't there because they're tree huggers, it's there because they're making money off of it. So there's lots of opportunity for businesses in electric car. In 2024, the electric car will be cheaper to build than the internal combustion engine, cheaper to build. But it's already far cheaper to maintain and operate an electric car. If you drive half an hour to work every day, you save about $1,500 a year, both not having to buy gas and the far lower maintenance costs with an electric vehicle. The opportunity of electric cars gives us a chance to use JEA's and Florida Power and Light's excess electricity capacity. It's far more efficient, less air pollution, and less expensive to generate electricity in a large plant the JEA or Florida Power and Light manages than it is to burn fossil fuel in a vehicle. And there's lots of business opportunities in vehicle sales, battery sales, charging stations, and charging cafes. If I owned a gas station, I would start creating charging cafes so people can come in, plug in their car for 30, 40 minutes, have a cup of coffee, and socialize. But this requires planning, ordinances, zoning codes, and building codes to be sure we have enough charging stations. I'll tell you a story about one business I know that put in electric car charging stations in their parking lot to serve their customers and remove them because their attorneys told them there might be liability issues if someone would electrocute themselves in the parking lot. Those sort of measures can be fixed by ordinances to give protection from those sorts of lawsuits. So there's a role for government here to help. And there's tremendous health benefits of electric cars and buses and trucks because of the decreased air pollution. So selfishly, as a doctor, I want everyone to go electric so my patients will be healthier, less asthma, less lung disease, less heart attacks, less cancer. And I like to say that friends don't let friends buy a gas car. The electric car is such a good deal now. They're a lot of fun, and just don't buy them. And if you need a truck for work, I guess you'll need to buy a truck still. But if you're looking for a family car, go electric and save a lot of money. So let's talk about what you can do in your business, whether we're talking about your business or maybe you're a consultant in the healthcare industry and it's a business you're advising. Adopt an environmental sustainability policy. Declare as a business that sustainability is one of your core values. I offer a sample environmental sustainability policy at the website that I manage for 12 medical societies, mygreendoctor.org, but there are many others online. Why do this? First, it's great for business, particularly your younger employees will be thrilled to work in an environmentally sustainable environment. Plus, it's going to be healthier for them. Number two, brag about your resiliency plan. If you guys are going green, brag about it. Talk to your employees. They'll be happy to hear about it. Talk to your colleagues. Talk to the Chamber of Commerce. Some chambers of commerce haven't gotten behind resiliency, and many have actually blocked resiliency efforts in the community. Don't let your Chamber of Commerce take that stance. Be proactive, lead Jacksonville into the future, and tell our leaders that we need a plan. Use best practices in your business for recycling, energy, and water use. It's good for business. It's good for the bottom line. Encourage wise transportation choices. If ride sharing or taking the bicycle or taking the bus are options, encourage your employees to do that. You can install solar energy if you own your roof. It's a big money maker. You will make money if you install solar energy on your roof. Or you can purchase solar power using JEA's Smart Solar program. So your business can go solar, adding just a small amount to your electric bill, and you can brag about that to your customers. Hey, we're a renewable energy business. Think about healthy foods for the office, healthy for your customers, healthy for the employees, and healthy for the environment. Maybe go meatless in the office, or go meatless one day a week. If you have a retail healthcare office, whether it's a physical therapy practice or a chiropractor or a dentist or a physician, think about going green in a sustainable way. I run a service called My Green Doctor, which is a free online practice management service that's created by the Florida Medical Association and now offered to their members by 12 medical societies. It's available in English, mygreendoctor.org, or in Spanish, mygreendoctor.es. It's now used by thousands of health professionals in 43 U.S. states and in 80 countries. It's an environmental sustainability program for any type of outpatient healthcare office, clinic, or facility. It's very easy to use, fully scripted. It just takes an office manager literally a few minutes per month to do, and it's comprehensive, science-based, and non-political. And most offices using My Green Doctor save money in the first month. Take a look at mygreendoctor.org. It's free, or you can call me or email me, and I'll get your practices started. How about your life? Adding environmental sustainability to your life. So if you want to make an impact in your own life, in your own community, you want to look at where energy is used. And this is an overview of air pollution emissions in 2017 in Florida. What you can see is that the biggest contribution are from transportation, 42%, and electric power. So if you want to have an impact in your own life, in your own family, look at those two parts of your life, transportation and electric power. We've talked about the electric car, and we've talked about solar power. Think about your carbon footprint. At mygreendoctor.org, you can actually look up how to calculate your carbon footprint. Buy Energy Star appliances. These are rated by the Environmental Protection Agency as being cleaner. You can see the LED light bulb there. Have only LEDs in your house if possible. If you're going to live in your home for 10 years and you have a suitable roof, wow, solar energy on your roof is a great deal if you're going to be in the house for 10 years. It'll pay for itself, lower your electric bill by at least $100. Always recycle in your home. Why have styrofoam? We don't need to have styrofoam. Just get it out of your work, get it out of your home. Think about red meat, beef, pork, and their environmental impact, and maybe go meatless or try to avoid those foods entirely for the sake of the environment and perhaps for the sake of your health. And think about those healthy fruits and vegetables and grains in your diets. Think about toxins in your home. Look under your sink and be sure that you're not exposed and your family's not exposed to toxins. When you go to the grocery store, look for this safer choice label. The Environmental Protection Agency has rated more than 4,000 cleaning products, including pet care products, car cleaning, and home cleaning products. And these are great choices. They're safer in the way they were created, in the manufacturing. They're safer in your home from a toxicity standpoint, and they're easier to dispose of. If you're looking at cooking appliances, it turns out that gas stoves are dangerous. A family that has a gas stove has 30% chance more likelihood of having asthma among their children. So if you have to choose between gas, which I love to cook on, but if you have to choose between gas and electric, go electric for your stove. Don't burn candles. They're full of toxins that cause dangerous air pollution indoors. And open those windows, particularly when the humidity is low in Florida. Finally, transportation. Think about walking, riding the bike, using public transportation where you can. If you're traveling by air, think about packing light, because those few extra pounds you put in the suitcase, the extra suitcase maybe you didn't need, not just bad for your back, but bad for the environment, because extra jet fuel has to be burned. Think about your use of air travel. If you don't need to fly, if you can do it by Zoom, why not? And finally, the electric car. This is a Tesla. These cars are a lot of fun, whether it's a Tesla or the new Ford Mustang, or one of the new Volvo. There's just dozens and dozens of great electric vehicles. They're a lot of fun and will save you money. So just to sort of summarize, I talked about that Jacksonville needs to have some sort of resiliency council. We need a 30-year community plan so that we have an ongoing regional, not just Jacksonville, regional resiliency program. We need better community awareness and community involvement. These decisions shouldn't be made by elite politicians. They should be made by the people themselves. We need to prepare for extreme heat, pollution, and storms. We're not ready for these extreme heat events now. We need a substantial plan to be ready. We need to protect our vulnerable populations, older people, children, people of lower incomes whose electricity may fail, air conditioning may fail during a extreme heat event, and our tourists. We need a renewable energy and energy efficiency strategy, and I think an electric vehicle strategy, so that everyone can enjoy the benefits of electric vehicles. So adding environmental sustainability to your business and to your life, I want to thank you. My contact information is there. I really enjoyed this opportunity. So thank you again to Jason, Kathy, and to Ashley for making this possible. Thank you. And I'm going to stop screen sharing.
Thank you. Thanks, Todd. We've had a couple questions come in on the chat, and I've got one to kick us off. So I was really interested when you showed the map of the United States and showed that the Southeast in particular was the one area that looked like other than a couple spots in Texas where the temperature hadn't rose. And I was just interested. I know you said that you'll see that where there's some areas that are more affected than others, but I mean, do you have any idea why the Southeast is the one area in the United States that doesn't appear to have that much of a temperature increase?
Well, some people think we've been moderated by the Gulf Stream. The Gulf Stream sort of takes heat away and may protect us. I don't want to leave the impression that there haven't been changes, but there have been changes in the mean land-based temperature. The problem we face is that although the land-based temperatures are not going up, the oceans have warmed. And it's that hot Atlantic Ocean that drives the evaporation into the clouds of more water, so it creates bigger storms, greater storms, and higher wind speeds. And so unfortunately, we're not off the hook because that also we're probably seeing some fluctuations in temperatures. We've already seen some hotter summer days and some colder winter days. So overall, the mean temperature hasn't changed. So we're not off the hook, but I think this may explain the political sense in Florida.
Yeah. Carol Cullen had a question, and it was, I think it was, the timing of it was pretty good because it was right before you showed the map of Florida with the sea level and the little sliver of land that was there, however many millions of years ago. But she said, can you speak to the flooding in Miami and how that relates to climate change?
Well, the flooding in Miami is a mixture of factors. Some people think that that part of Florida is actually sinking. So that's part of it. Plus the sea level rise, and the sea level rise is due to several things. Part is that the glaciers are melting, so there's more ocean out there. But interestingly, a warmer ocean actually expands slightly. So it's the expansion of the ocean. It's actually an increase is as important. So it's a mixture of factors, but it's very real. And the high tide flooding is a serious problem for St. Augustine and much of metropolitan Miami.
One question from Josh Jolly: how predictable is the output of solar power?
Well, it's very predictable. The problem is that Florida doesn't have great solar resources. If you take a satellite view of Florida, we actually have a lot of cloud cover compared to places like Arizona, where you might not see a cloud for 3 or 4 weeks. So we have good solar coverage, not great. We put solar panels on our home about 15 years ago. We saved about $120 a month. We paid for the panels a long time ago. There's several benefits from solar. You do save some money, no doubt about it. But the real benefit is that once you put solar on your roof, your whole family gets kind of infected by it. You find your kids start turning off lights and they start flushing the toilets and recycling. So there's an impact on the community of people of using solar that's far greater than just the power benefit. The power benefit's real, no doubt about it, but it's not as dramatic as it would be as you lived in, say, Arizona. I should say the panels do deteriorate with time. By 20 years, you're not getting that much out of them, but they're very solid. We haven't seen any deterioration in ours yet. Been about 15 years.
Okay, I don't see anything else in the chat. Does anybody else have questions? Just feel free to take yourself off mute. And
hey, Dr. Sacks, this is Josh Jolly. Thank you for the presentation. It was a really important topic, and appreciate the work you're doing. I found it interesting, just in sustainability in general, access to clean drinking water is something that I hear about periodically, but I noticed you didn't touch on that. Are we at a point where, I don't know if you're aware, is our local government taking steps to ensure the sustainability there, or is this not a threat right now?
Well, I know a fair amount about this. I served on the water committee at the Environmental Protection Board and chaired that. So we would see the water quality reports. JA does an excellent job at monitoring its many pumping stations. There has been a slight increase in salinity in the drinking water access wells in Jacksonville, but it's not a problem now. JA has great access to water. By the way, the water quality and the JA gives us is tremendous, far safer than bottled water. Remember, it takes two bottles of water to make a bottle of water, and all that plastic. So throw away the water cooler. go with JEA's water supply. Sometimes it tastes a little funny. I find if you chill it, it doesn't taste so bad. But the safety of the water is tremendous. And it's going to be that way for decades ahead. We don't see an imminent problem occurring.
Hi, Dr. Todd. Thank you so much for everything today. Very informative. I wanted to ask what we think we will be doing in preparing for some of the health conditions that you think are going to happen with, as you outlined, with increased asthma, increased cancer. Are we educating people more, or how are we helping people prepare to compensate for those expected?
Yeah. Great question. My hat's off to the city council. They really did roll up their sleeves and work very hard on this. There are so many issues, and I raised some of them, that are now before the city council. There are people writing legislation. This is a long-term planning process. I think the first step is going to be to have our city resiliency officer up and running, because then you have an office that can get us grants. There's lots of grant money from federal and state level for just these kind of issues. So we need as a city to have a structure so we can get public opinion, we can generate proposals, we can then get the grant money and get this going. We can do this. You know, it's a many-year process, but yes, it's not happening yet, but I think the city council has lit the spark together with Mayor Curry to get it done. But you know, your role as chamber leaders, as community leaders, take advantage of that. Talk to your city leaders and ask them, hey, what are you doing on this? Let's keep this ball rolling. That's why I'm here, because you're the leaders of our city, and I'm very grateful to you for listening to me, because I think it's so important that we all do what we can to keep it going.
The awareness helps. So thank you for helping us become aware.
You're welcome. Thank you.
Anybody else? Time for a couple more. One thing. Yep, go ahead, Josh.
Yeah, I was gonna say I have another one if no one else does. As it relates to electric cars, I think what I hear from critics is about the sustainability of the batteries, and how disposal of those can be a very sensitive thing. And I'm not well informed on that. Could you speak to if that's a serious issue, or how the disposal of car batteries for electric vehicles impacts our environment?
And I don't know either. I do know that disposing of sulfuric acid batteries is also a big environmental issue, but I don't know. I have an electric car. I've only had a couple of years, and I haven't experienced that yet. What they do in China is very interesting. They have a different model. You don't own your battery in China. You go into a gas station-like facility, you drive in, and a technician goes under your car and removes the battery and pops in a replacement battery, just like popping in a propane tank you pick up at Ace Hardware. It's so interesting. It's
rather than charging them?
No recharging. That's right. You just drive in, you give someone a couple bucks, and they pop in a new replacement battery. So you don't own your battery. You don't have to replace it. It's a fascinating model. And gosh, hats off to China for thinking about that. They have these battery exchange facilities all over the place, like gas stations. So you don't need to. So one of the problems in America is if you live in an apartment house, where do you charge it? You don't have a regular parking place that's indoors where you can charge. And even many people's garages might not have plugs to charge. So China's overcome that. It's really fascinating.
One thing that may be interesting, and I know when we talked before, when we were talking about putting this presentation on, I brought up the topic of, well, what do you do if you want to drive across country in an electric car and there's not a charging station? And if you maybe speak on that a minute, just the availability of charging stations throughout the United States and how far you can go, and how you've overcome some issues around that.
Yeah, it depends a bit upon your car. The current cars, all of them have 200 miles that are being sold today, have 200 miles, and many of the newer cars, like the Mustang and the new Tesla, the standard Tesla you spend $40,000 on, gets about 320 miles battery capacity. I think that's This month's model is 340. So you can go almost anywhere. You can certainly get down to Gainesville and back. And so for many people, they look at their electric car as kind of their second car. Maybe they have a larger family car for the long trip that you take twice a year, but the electric car is fine for day trips anywhere around Florida. Now, if you go longer, there are great charging stations all over the place. That when we travel in our Tesla, you simply put into the computer where you're going to go, and it takes you right to the charging station and tells you you're going to be in this charging station for 18 minutes, just barely enough to get a Starbucks, and then you keep going. And it costs about $2 to fill up your charge. So Tesla's got the technology down great. The other manufacturers are coming along pretty quickly. It just isn't a problem. You know, my feeling, if you're going to drive to Miami, you really should stop for 20 minutes from a health standpoint.
All right. Well, we're coming up on 1 o'clock. So one question that I've asked of probably almost all our speakers, and I think you've done a really good job of probably already answering this, but maybe you can just summarize. You know, I always ask, okay, what's one thing that we can do to help